right, welcome to Skin and Bones podcast number 5. Today is December 21st, 2021. We're almost flipping a chapter to the new year. The holidays are pretty much upon us, and Zach and I are back for another episode. For those of you first tuning in, my name is Dr. Peter Gust. I'm a dermatologist, and this is Dr. Zachary Hill, an aspiring orthopedic surgeon about to go into his fellowship. And we talk a lot about medicine, some random stuff in life. And our last episode got a little bit cut short for those of you who actually got a chance to tune into one of our truncated episodes. Why don't I let Zach talk a little bit about that?
Yeah, for the 5 people who watch, again, this is Peter and I do this for fun and just to catch up, but I'm not on call tonight, so it's not going to happen, but I was on call last time. And so when you're a junior resident, you have someone who stays in house, especially at a level 1 trauma center, just because there's a lot of trauma that comes in. You need someone in house to see all these patients through the emergency department as an orthopedic specialist. When you're a chief resident and you're on call, if there's any questions about management of patients, things going emergently to the operating room, they are your first call. And it's kind of like one of these things in orthopedic surgery. It's like, you don't want to call your chief because you're like, I want to take care of things by myself.
You're beating your chest.
Yeah. But sometimes you gotta make a call to the chief. And he called me, and so I had to cut it short without expressing anything. It was a patient who came in with a dysvascular leg that was actually surgically preliminarily fixed at an outside facility. It had an external fixator, which means that they had pins placed in the femur and in the tibia that span the knee to hold the knee reduced because the knee dislocated. And this patient actually had a total knee, so a knee replacement. And so vascular was taking it to the operating room to do a revascularization procedure because his artery was out, and they needed me to come in and remove the external fixator for the procedure. And it's one of those things where for vascular surgeons, time is limb, right? So there's very few times where this comes in, but if you have a dysvascular extremity, time is limb, and as far as it can be viable, can it survive? So there wasn't much of a workup. So in that case, the junior resident did a great job. He called me, he expressed the situation, how much he knew at the time, and said, Zach, this is going to the operating room. And I changed immediately into my scrubs, went into the operating room, called my attending on call and just said, hey, here's the situation, which my attending said, well, what about this one? I'm like, I don't have those answers for you right now. I'm going to get them for you. And long story short, the patient's doing well. He's keeping his leg.
That's great.
So yeah, everything's good. And but it's just one of those things when you're on call, you just got to be ready at the drop of a hat and you never know what the night's going to bring you.
Yeah.
And so you got to stay ready. And I can tell you that when I sleep, when I'm on call, it's a lot lighter sleep. Like it's like this, like when Megan moves in bed, I'm like, like, the pager's right next to my head. My phone's on loud right next to my head. I've told the junior residents, like, hey, this is how I want things done because this is what works best and it's the most efficient in my eyes. And so it's a good communication. And my junior resident who's in house did a great job. He did exactly what he was trained to do. And we talked about it. And that's part of education and learning to be a good surgeon who's going to take call one day. So patients doing well, and that's what matters.
A couple of things I take from that. You use a lot of fancy lingo there as far as orthopedics go. We tend to use words and things that they teach us to kind of talk about it on like a 5th grade reading level, but it's one of those things that's really hard to do because it becomes a different language and things like that. And I find myself doing the same thing with dermatology and using all sorts of acronyms and things like that all the time. But that was awesome. You were able to let this guy keep his leg because you're able to make sure the vascular was doing their own thing, and then you were doing your side of things, and it brings in the whole collaborative nature that medicine is today. I was kind of makes me think about a patient I had today who wanted a certain medication, and he has a couple of other medical problems. And I was trying to explain to him that I wanted to run it past some of his other doctors before I started him on this new medication. And just getting buy-in from the patients and being willing to adapt and work in a collaborative manner as far as healthcare goes. I know you had to be on call, and you were the senior resident who needed to kind of swoop in and save the day, even though the junior resident had it controlled from their level of experience. So it's interesting to hear that specific example from you.
Yeah. And when you work in a trauma setting, you're working with a lot of different teams. You're working with the general trauma team. In this case, we're working with the vascular surgeons. And I have a good relationship with one of the vascular surgeons, just for everything. I won't say his name, but he's an amazing person. We've worked together. We hang out on the weekends. He's just an amazing guy who I will continue to keep friendships with, because he's just a person who cares. He's a godly man. We've had a lot of great conversations together. And I saw that he was on call, and I immediately called him, and I was like, "Hey man, I'm coming in. What's going on? How can I help you?"
Yeah.
And it was one of those things that it went really smoothly. And he was there. I went in and was there for like 2 hours, 2.5 hours. He was there all night. And that's just I've been it's been flip-flopped a couple times, or it's been the opposite case where I've been in there all night. And he's like, so yeah, man, I mean, sometimes you gotta play nice in the sandbox for sure. And establishing those relationships early really helps. Definitely.
Yeah. So I think that's a good transition into kind of talking about what we had planned for today. So we talked about previously a little bit about our journey through undergraduate before we went to medical school, people that made an impact on our lives, decisions we made, experiences we had prior to medical school, what went into those decisions as far as reasons for doing things, whether it was for passion, the naive nature of us little kids at the time, it felt like. And we definitely discussed that a little bit before, but that kind of transitions into what we wanted to talk about today. Was once we made it to medical school, what are the things that helped us succeed in medical school? So this is a little bit going to be more geared towards any pre-meds out there who have just been accepted to medical school, or anybody who's thinking about it as a career, or maybe even a career change. I know we had a lot of medical students and classmates that were actually a lot older than us and had gone through multiple career changes, which was really cool at the time, because that they came in with a lot of different life experiences, and they actually made a little bit more of an educated decision as compared to mine personally, and based on our last podcast. But I guess, Zach, I'll let you take it first as far as what do you think medical schools are looking for, and what do you think helps someone succeed in medical school?
Yeah. So I think, to me, there's a disconnect. And I know that we talked about a paper when I was a fourth year medical student about what are the actual, there's one thing, if there's a question that's been asked in the medical realm, I guarantee you it's been answered in a scientific journal paper. And I'm sorry, I don't have this one in front of me right now, but they looked at the qualities and characteristics of what the typical applicant had versus what characteristics made them successful. And so that's actually been studied. And I'm not going to quote the paper. Hopefully I'll read about it and I'll bring it up and I'll give like a quick, like 2-minute bullet point thing on it. But I remember looking at it, but most medical schools want someone not from a strictly scientific background. They want people who are intelligent. They want people who are hardworking, and they want people who are unique and diverse. I mean, I think those are the 4 things that they really are looking for in looking at acceptance for medical applicants. There are over 300 MD and DO medical schools in this nation. That is a lot, right? So you got to think anyone can apply to medical school. Even if you didn't take the right classes, you can still apply to medical school if you want to throw your money away. But for some way, they have to weed through that process, right? So they have to look at, what is your overall GPA? what is your medical school GPA, which is the acquired chemistries, biologies, physics, science courses that you need to take. So what is that? Those are two aspects to it. Have you done research? Have you done any volunteer experiences? And really being on the side of just, I've done a couple interviews for medical school when I was with the president of our class of medicine, but being on the side of now doing residency interviews, it is extremely challenging. You have a lot of very well qualified people who are coming on paper. And you're like, how do I make this decision? How do I narrow it down from 800 people to, we have a class at Loma Linda, we had a class of 180, I believe, when we graduated. I think we started with 196. If I'm correct.
Yeah, I'm not sure.
How do you weed that down? And all these people are extremely intelligent. So to sit on a committee, and each committee is going to be a little different in what they're looking for in a certain applicant. You know, a school that is high into academics and publishing literature that is cutting edge, like Harvard, like Columbia, like those big schools that everyone's like, oh, ivory towers. You better have some research behind you, or you better come from a very diverse background, because they want to hear the story about the first generation immigrant who was in their parents' store, and they were in a room full of 10 people. Like, those things actually speak to people, and some of those things you can't control, but that's just the truth, right? But the second question that you ask is, what does it take to be a medical student? And that's different. But from my perspective, I want to hear what you have to think about what medical committees are looking forward to. And there's a YouTuber called MD Insiders, med school insiders, who does a really good job of overviewing this topic, as well as far as what are committees looking for in applicants. And I recommend that everyone who's interested in applying to medical school takes a look at that, and sees how, and there's data, there's plenty of data. How competitive are you? And there's actual data out there that you can look at and crunch. And if you're like, I don't want to do that, well, get used to it, because you're going to be doing it for the rest of your life. So I'll leave it to you.
I think
I'll throw the ball back in your court.
Throw it back in my court. So succeeding in medical school, I think is definitely changed quite a bit since we've even finished. Necessarily, because the whole goal of medical school is to get you a baseline education, an overview of the human body, and when something goes wrong with it, and to actually get you into a residency where you can actually learn a craft that is specialized in allopathic medicine, or osteopathic medicine, whether you went to MD or a DO school. And it's really aiming to try and get you a residency slot, because you don't learn medicine really until you're in residency. That's where you learn how to be a doctor. And I don't think a lot of people really
Unless
realize
an orthopedic surgeon, because we learn how to fix bones really, really well. And we learn medicine in medical school.
Yeah, you learn medicine in medical school, but you also have to use a certain amount of it your intern year when you're doing floor work and you're doing all sorts of stuff. So don't discredit yourself that bad, Zach. Okay, you can put your skull cap back on and make bones straight later. But we all know that you went through a lot of pharmacology training and everything like that, which you learned your basis knowledge in medical school. Yeah. But really what helps you succeed in medical school is just being incredibly organized, which I am not very organized by nature. It's something that I changed into during medical school, having a plan as far as time management. Time management carries over. You develop a huge it's a necessity in medical school, and you really need to be very disciplined as far as your time management goes, as far as even setting aside break times, making sure that you're exercising enough, and just making sure that you're planning ahead, because those tests come at you super fast, and there's a whole lot of knowledge that you're supposed to learn. And medical school, really, when we went to medical school, it was a whole lot of facts and regurgitation. Minus I would say probably our pathophysiology class, minus some of the third and fourth year rotations, with some of the attendings that actually pushed you to connect the dots, to learn how to think critically. So I'm not saying the entire time it was just a lot of regurgitation, but in order to somehow rank all of these people who are incredibly intelligent, incredibly smart, on some basis where they can figure out who deserves a residency spot later on without fully 100% getting to know you. Because let's be real, when you go on a residency interview, you're not barely getting to know someone when they're only there for a night, for a dinner, and then 10 minutes to talk to each of the faculty.
Right.
So as far as succeeding, it's all about time management, making sure that you're put in the hours, because unless you have an extremely, everyone says they have a photographic memory. I don't necessarily know what that means, but like, you need to put in the hours, and you needed to do that in order to have the knowledge to regurgitate, for lack of a better term. But then also you needed that knowledge as a basis to build connections, to build neural pathways in your mind, later on when you're on the wards and the attending physicians are asking you what are the top 5 causes of this, and then ask you, well, how does that deal with the heart, when we were previously talking about the kidneys, and kind of being able to connect the dots. So adaptability is a huge thing too. Being able to adapt with your plan, because you're not always gonna have enough time throughout the day, and you need to prioritize. Adaptability and prioritization are huge in medical school as well. So just a few things. And repetition was the biggest thing for me as far as learning the material, because it is boring stuff. A lot of it is boring stuff. I thought a lot of it was pretty cool, but then you're sitting there trying to learn about something that you never once thought you had a passion about learning, and then all of a sudden you've drawn out all the different electrolytes being taken in and out of the kidneys, when you had no idea what transporter was there before, and you don't really care. And me right now, I don't remember it. So having the wherewithal to just kind of put your head down and get through it, and then understand prioritization as far as what's important to learn in the field that you're going into. Zach jokes around with the fact that he's just making bones straight now. He doesn't have to deal with managing someone's high blood pressure too much. He doesn't have to counsel people on insulin resistance and which vitamins are fat soluble and which ones aren't, that sort of stuff. But yeah, it's that sort of stuff, and prioritization is the key to that game, because you're going to need to learn it at one time, but then be okay with replacing it with a little deeper knowledge in this specialty you're going into. So those are a few of my thoughts. I don't know if you want to expand upon any of that.
Yeah. So I think you kind of hit on the head about, I kind of talked about what medical schools are looking at. And I encourage everyone to look at MD Insiders, and there's a great video on that. And he really dives into it. But what does it take to be a good medical student? And you hit it on the head. It's really about time management, repetition, and you need to have a willpower in you to say, I'm not stopping until I understand this. And that's if you really want to be successful in a medical career. Because again, you can go through medical school, you can pass all your tests, and you could be a doctor at the end of the day. You could do that, or you could be someone who is very motivated and says that I'm going to need to know this in order to affect patients' lives. And I think it's those people who really turn out to be really great physicians and don't just strive for middle of the road. And I think, like I said, I met a lot of smart people in medical school, way smarter than I am. As far as like, and again, I think I'm an intelligent person, but I've met people who are just like, how do you remember that? How can you connect those dots, what you were talking to, so easily, and you're just kind of blown away by it. But it was my work ethic. It was putting in the hours. It was going over it again and again and hammering it in and then until I understood it from every single aspect and direction. I was like, okay, I got this. When I went to take my test, there was nothing that they could throw at me that I was like, at least kind of say, okay, I think this is what they're talking about. There's nothing that I went in and I was like, no idea, right? Like, and I think we had a great medical education at Loma Linda Medical School,
Mm-hmm.
but I think it takes those people who are not only gifted with intelligence, because again, if you're listening to this and you think you're smart, wait till you get to med school. You will find some people who you're just like, whoa, like I can't even be around. Like I'm surrounded by people in my residency who are just extremely intelligent too, and
Mm-hmm.
I learn something new every day, and I'm blown away every day how people know some things.
Mm-hmm.
But it's that dedication to always learn, to always grow, to always apply and find new ways to apply it for your knowledge and for the better of the patient. And
Mm-hmm.
so, how do you look at those things? How do you look at those things on a paper applicant? How do you ask those things in an interview? It's very challenging. And, I like I said, I think we started with a 196. I think we graduated with one. Jeez, I had my coffee mug. I think it was 172.
Yeah.
Right? Not everyone makes it through.
Mm-hmm.
And, I think that that's actually dying off, that a lot of medical students are making it through. And to me, I think that's actually a travesty. You're seeing it with, hey, we're not going to give a score for step one. We're, we need to make sure that the people who go into this field are there for the right reasons, are intelligent, who understand the material, and who are willing to put in work, because they are dealing with people. They're not dealing
Mm-hmm.
with numbers.
Mm-hmm.
They're dealing with people's health and their decisions, and informing them about their decisions to make those health decisions.
Mm-hmm.
And so I actually think that, I'm one of those people who, if you're not good enough, you're not good enough. I'm sorry.
Mm-hmm.
Um, so yeah, I think that's what it takes to be a good medical student, is to, hey, I want to go to bed at 10. Sorry. You're going to be up till midnight, 1 o'clock in the morning if you don't understand things sometimes.
Yeah.
That's what it is. If you have that mentality, you'll be fine. I forget where I heard this. I think it was in that PBS thing that I talked about the Harvard
Mm-hmm.
medical students in the last episode. I
Mm-hmm.
remember one of the guys. He was a big guy. He went into emergency medicine. He had red hair, mustache, and he said, "You don't have to be smart and be a doctor. You just can't be stupid and be a doctor." And I was like, "That is a good point. That is a very good point."
Huh. That's I think that personalities have a huge deal with it too, and they come into play because I know that we stayed up so late studying all the time, but I also remember quite a few times where I would stay up that late and I was getting nowhere.
Yeah.
I was getting nowhere, and you reach kind of a roadblock. So I think the majority of what you're saying exactly is true. Being able to put in the work behind the scenes, being able to sacrifice certain things. But at the same time, I think that prioritization and kind of having good insight about yourself is to know when it is time to go to bed and maybe wake up a little earlier and say, hey, I need to just refresh. I need to go work out for 20 minutes, set a time limit for these things that you're doing, have a plan, and have that plan adapt, but just don't quit and stop with no alternative in place for it. So I think
Yeah.
certain personalities were able to stay up later and study. Certain personalities were able to get up really early and study. I mean, it goes to the fact that some people are morning people, some people are night owls. I think that there was definitely not one study plan that worked. Some people liked
Oh,
using flashcards. Some people liked writing outlines. Some people like using pictures and Picmonic and picture mnemonic things to learn all sorts of pharmacology. So just because you don't view yourself as just like everyone else in medical school, that doesn't mean that you can't succeed. I think just the overarching theme is putting in the work behind the scenes, and knowing that you're not going to get instant gratification by any means, through for a very long time.
Yeah, you gotta be willing to work, and you gotta be, like you said, you gotta be able to adjust your plan. And I mean, how many people did we see who were really intelligent but never really had to sit down and study? They've never had to study for this long in their lives, and they had no idea how to do it. But when you're getting this much knowledge, you have to make a system that works for you, and you have to recreate that system.
Yeah.
And so it takes that adaptive personality. And again, if someone has a rubric on how to find these people, I'm open to it. But there's some people who I've met who I'm like, I would never trust you with anyone in my family. And there's some people I've met who I'm like, how are you not like furthering civilization with Elon Musk on Mars? You know?
Yeah. I think a lot of people in consulting roles, in management roles, would probably do pretty good in medical school, just because they're constantly having to deal with problems that are based on systems, and coordinate what's going to be the most efficient way to do things. And that's what I felt like we did all the way throughout medical school. And then you just put in the time. And you're constantly problem solving, but at the same time, then you just put in the time. So
Yeah.
that's some good thoughts on that.
Yeah. Yeah.
You
Agreed.
got anything else you want to bring up?
No, I mean, I don't. I've given advice to multiple people who think they want to go into medicine, and
Mhm.
it's a lot of what we said is the same thing. And the hardest part for me was getting into medical school. Once I got into
Yeah.
medical school, it was, this is my job. I'm going to be good at my job.
Yeah. There is a certain amount. I know a lot of people hate me for saying this, but there is a certain amount of luck to it.
Oh yeah,
There is a
100%.
certain amount of luck, and there's a lot of networking and putting yourself out there in just the right way, trying to be friendly in just the right way, but not being annoyingly kind of forward. And the same goes for residency applications, medical school applications, and a lot of times even college applications. It's hard to get into college these days. I was talking to some parents in California, and like they're trying to get their kids into college, and just hearing about all the insane stuff that goes along with it. You remember that whole scandal with the people who were basically paying to get their kids into like USC, and I forget who that was. It was that
It
lady from
was
Full
Full
House.
House. Yeah.
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 But just the fact that people are doing
She
that
wasn't
is,
struggling to get her child. No, that's a misnomer. That she wanted her kid to go to USC, and
and
my daughter's going to USC, and it's travesty that people are getting on, not on merit.
yeah, I hear what you're saying. All right, so I think we've definitely had a few good things to say about that. We had one of our listeners ask us about New Year's resolutions. Do we do them? Yay, nay? Do they work? And do we have any? And that's a great one, because I've definitely, Cynthia and I used to have this little whiteboard in the kitchen, and we would write down at least 3 or 4 New Year's resolutions. And I think that probably we would get 1 out of the 5 things every year to kind of stick. And that honestly was a success in my mind. There was definitely a couple of things on each list each year that we didn't even come close to even trying. So I think it's a good idea to have New Year's resolutions. I think that it's a certain aspect of setting goals, and if you set goals, they need to be realistic goals. They need to be something that you can measure. There was a mnemonic for this. I forget what it is, but basically it was a study that talked about how to actually accomplish the goals that you set. And that's what New Year's resolutions are, is they're basically goals that you're trying to achieve, trying to change yourself in a certain way for the better, most of them. So I think that it's important to actually be okay with not meeting your goal right away. Everything you can change one day at a time, small small steps forward and small steps backward, and then you're going to keep taking bigger steps forward the more you fall backward, and it's just like a slow process. So I don't know, I believe in them, but I don't know if they're necessarily easy. I just think that a lot of people need to learn how to actually measure their New Year's resolutions, because a lot of people will just say something and they have no attainable measure. They're not writing down what they actually did, because as human beings, we're always going to look at what we didn't do, and we need to actually visualize what we are sacrificing and the positive strides we are taking day in and day out. And I think that takes a plan, and that takes making sure that you're actually analyzing what aspects you've put in already. I don't know, recording your steps to accomplishing your New Year's resolutions.
Yeah, I mean, I think it's good in the fact that everyone knows like New Year's resolutions, right? So it's a chance for you to reflect on your life and look and say, hey, these are things that I want to change about my life.
Mm-hmm.
Fact of the matter is, people usually don't follow through with it, right? And I think it's because you lack discipline. And I think everyone to a certain point, life gets in the way. Like, I want to go to the gym 3 times a week. I want to start eating so many carbs, right? So, but it's like there's no real goal and there's no like written out plan.
Yeah.
And a goal without a plan is a wish, and those things always fall apart. And so to me, it's like you need to have a set goal. You have to have a plan for that goal, and you have to have people who hold you accountable, right? Like,
Yeah,
I think that's
a
the
key.
best thing. And like a timeline, right? You're like, in this time,
Mm-hmm.
I want to get this goal done by doing this, and these people are going to hold me accountable.
And this is how I'm going to do it, and this is how I'm going to track how well I'm doing it.
Yeah, and you can totally do that. And if you write it out and you follow it, and you have people who are saying, hey, Zach, you said you wanted to, start going to the gym or go to the gym 5 times a week. How's that coming along? Yeah, I had a hard time, this last week I was on call a lot, I got home late. I only got like 3 in. All right, well, is there anything that you could be doing that could change? Like, if you have people who constantly hammer you about that, you're more likely to get that goal. And setting a time frame, right? If you have an end date, right? If you just say, I'm going to stop cussing as much, that means nothing, right? Like, that means absolutely nothing. But if you're like, hey, I'm gonna, every time I cuss, I'm gonna send my wife a text message that said I cussed, and then she's gonna say, all right, that's $1 towards this or that, right? It's something that holds you accountable. With that being said, do I like New Year's resolutions? I do, in the fact that it makes you reflect on your life and it reflects on what can make you better. Do I like them in the essence of, oh, my New Year's resolution? No, I don't, because you should be able to self-reflect on yourself all the time. And if you see something, you should hopefully discuss it with someone and then make a plan to change it. Like, I don't know why people are like, I don't like this about my life, but I'm gonna keep doing it and keep going with it. Maybe they're afraid because of embarrassment. Maybe they're afraid because they don't have someone to hold them accountable or talk to about it. Maybe it's something they just like to keep in the dark. Believe me, all things come to light. And so, yeah,
we're creatures of habit. Totally. I mean, humans are creatures of habit, and we just perpetuate our comfort zone. And we find ways to just stay within our comfort zone. And totally. I think in a way, the longer you stay in your comfort zone, the more you feel like you're winning. But the reality of the situation is, if you're trying to actually attain your goals, that in and of itself is stepping out of your comfort zone. And that's why it's not easy. That's why New Year's resolutions aren't easy, because it takes work. It takes planning. It takes setting a timeline, like Zach said. And do I want to do that after I just came home seeing 30 patients at clinic, and 10 of them were not very happy with me for one reason or the other? And I want to sit down and write a plan about how I want to lose 10 pounds in the next month and a half. And I'm going to do it by drinking more water and eating less soda and only eating this amount of calories every day. And I'm going to make a outline. Do I want to do that?
No. Beer at night? No, I don't want to do that. I want to eat my fast food, and I want to enjoy my burrito, and I want to drink my beer and go to bed.
Because we're human beings and we're
Yeah,
creatures of habit, and
it's
we need
easy.
to somehow be creatures of balance as well.
Totally.
Some people utilize that as a crutch at the same time. I mean, you hear people joking all the time. They're like, oh, I'm only going to have half of this chocolate bar because life's about balance. And then they pick up like a half a pizza as well in the same city, and they're like, oh, I'm just everything's about balance, and it becomes a joke. So at what point are we actually tracking what we're doing? And that's what a lot of successful people do. They're writing things down. You can do this by journaling. Even there's a lot that can be learned as far as writing things down, whether or not it has a timeline, whether or not it's tracking any progress. It's getting your thoughts on paper so that you can have ideas for learning how to track, learning how to analyze your day in and day out behavior.
Yeah.
But I don't know if I have specific ones
No. And
that
I
right
mean, the
now.
thing is you don't need to, like, you have this device. You can literally say, "Hey Siri, remember this," and it'll be like, "Okay," and you can look at it later that night. I mean,
Mm-hmm.
it's not like it's hard. Um,
Yeah.
yeah, I don't have any New Year's resolutions this year. I made a resolution to myself to just be healthier physically, mentally, emotionally, spiritually.
Mm-hmm.
And those are things that I've been keeping myself in check with, and my wife's been keeping me in check with.
Mm-hmm.
And if it slips up, trust me, she
It's
lets me
not.
know.
It sounds like a wish, though.
It's not a wish.
You
I
have
have a plan.
accountability partner,
It's it's
and you have a
it's
plan.
some things are personal, dude. Some things are
Oh,
personal,
oh,
bro.
we're not going to talk about everything. What?
Yeah, no, we're not gonna talk about everything, man.
Okay. Oh man.
Yeah.
Well, anyways, New Year's resolutions. That was a good one. I wrote a couple things down here as well. I was having this kind of jumps back to what we were talking about as far as med school, though. Um, in med school, I felt like learning the details was super important, and in residency, I feel like seeing the big picture before you focus on the details has been an ultimate shift in the way that I have needed to become as a thinker and as a physician. And I was wondering if you've run into situations where you've actually had difficulty kind of seeing the forest through the trees, so to speak, in your in the OR, or whether you're seeing patients on the floor, or what specific instance do you think that you find that the hardest? Because myself, it's usually in some complicated like rash patient where I'm trying to like put them in a certain box of an inflammatory pattern, and
Uh-huh.
in the end, I'm usually going to biopsy them, but then the biopsy comes back non-specific, and I'm having 100 different details flying through my brain. And then it usually is like, okay, let's just pause and then think about one detail at a time, and then kind of lump that into a certain basket. And that's why I love dermatology, because you can look at the pathology, which is the skin that you look at under the microscope, and you can see the inflammatory pattern. You can see whether it's necessarily even an inflammatory disease process, or if it's a neoplastic or cancerous disease process, and what are the cells it's predominantly made out of. And you have little bins for each of these that help you narrow things down. And once you take one predominant factor on pathology, you can definitely start to see the forest, and then whittle it down with different clues to where you can zoom in on the trees. But that would be my example of it.
Yeah. I mean, I think that this is why residency is so long, and it's medicine and the practice of medicine. It's always the practice of medicine, is
Mm-hmm.
because you're constantly learning and you're constantly looking at the patient as a whole. Or say you have a fracture and you look at it and you're like, that needs to be fixed, and the orthopedic surgeon, bone broke, fix bone, right? Like, that's not necessarily the case, because patients carry different risk stratification. Surgery is not a benign process. And some patients have a significant amount of comorbidities. And then from an orthopedic standpoint, we look at their functional status.
Mm-hmm.
How much function is this surgery really going to give back to this patient? And is it
Mm-hmm.
worth undergoing the risk of surgery?
Mm-hmm.
Maybe they got, congestive heart failure. Maybe they have valve occlusion. Maybe have all these things to restore their function. Well, what was their
Mm-hmm.
function beforehand? Oh, they were just getting up from their bed and going to the toilet and getting down to, that's a different functionality than someone who gets up and does all their activities of daily living, goes to the store, picks up their kids, goes on bike rides. Those are two different patients,
Yeah.
right? So it's like, what are we? And then there's always post-operative complications, infections, the bones don't heal correctly. What if something happens, or if they re-injure it, or if the hardware fails? What's my bailout procedure? These are all things that you consistently look at and you say, okay, what is the best thing for this patient as a
Mm-hmm.
whole? And so there's no one right answer.
Yeah.
And that comes with the practice of medicine. And I love that that is what it's called.
Yeah.
It's nothing's ever perfect. What you do for one person may not necessarily be the same for the next person.
Mm-hmm.
And we can only go off what we've been trained to and what's comfortable in our hands, and do what we think is best for the patient.
Yeah. I like that. That reminds me of a book, the last book I read. I haven't read too many books recently, but in residency, I was reading a book by a general surgeon, Atul Gawande, who's one of the like best physician writers there has ever been. But he wrote a book called Being Mortal, and it's called Medicine and What Matters in the End. And essentially, it talks a lot about end of life care.
Yeah.
But you kind of reminded me of it because he learned from a really good palliative care hospice physician a few questions to ask patients, and I can't remember the questions off the top of my head, which is making this even worse. But you guys, if you're really wondering what end of life care is all about and how physicians cope with it, and how our training kind of comes into conflict a lot of time with cultural expectations, and how that even comes into conflict based on what culture you grew up in, where you're living at in the world,
Yeah.
how affluent that is. And he just is an incredible writer and does a lot to describe that situation. But there was 3 questions that this doctor basically told him to ask people in order to help him better see their priorities.
Yeah.
And I'll have to look into
with
that.
neurosurgery,
Yeah.
he's a neurosurgeon. With neurosurgery, you're really looking at those questions, because
I thought he was a general surgeon.
no, he's a neurosurgeon.
Ben Carson's a neurosurgeon.
Yeah, he is. He's also a dentist. That's how you know that.
That's true.
But again, it's, the outcomes of some of these brain tumors are not great. And understanding there's morbidity with everything that we do, especially in neurosurgery, and there's recovery time. I don't know how people do it in the oncology world and cancer, but we're talking about treating, cancers, and they know the numbers, they know the prognostic outcomes, but you can't take down a fighting spirit, right? And so it's challenging, right? We live in I come back to this, we live in a fallen and broken world, and nothing is perfect, nothing. And we can only try our best and treat our patients with the evidence that we have set before us and what we can feel like we do. But at the end, we can never lose sight that it's the patient that comes first.
Yeah, it's true. Bless you.
Yeah. With that being said, though, I got to skedaddle.
You got to skedaddle. I'm going to think of a punishment for you for next week for getting the fact that he's not a neurosurgeon.
Is he a general surgeon? I thought he was a neurosurgeon.
I know. I'm pretty sure he's a general surgeon. We're going to look it up, and we'll start our next episode next week or whenever we record that. I'm headed up to Michigan tomorrow to see my family for the holidays, which should be awesome. And hopefully we'll record when I get back in about a week.
I'm going to miss you.
You are? You're just going to call me anyways.
Yeah, I will.
All right. With that being said, Skin and Bones is out. Make sure to comment, leave us a message on social media, and let us know what you like and what you hate about our podcast, because we'd love to hear from you.
I like the hates more than the likes. So Keep 'em
Yeah.
coming.
All right, you guys. Thanks for listening.